Hi, my name is Olivia Jackson. I'm here with my patient.
Olivia.
I'm going to record a head-to-toe assessment on August the 25th at 8 p.m. I'm going to scan the room. I'm going to begin by assessing the skin. When assessing the skin, I'm looking at the temperature, the texture, the color, the warmth, the moisture. I'm looking for any bruising, swelling, edema, swelling, any laceration or scarring or lesions or nevi, and I'm assessing both head to toe. And I'm going to assess the posterior chest, the anterior chest, the abdomen, the head, neck, and the face. Okay. Now the head is in the midline position and it is straight and it's symmetrical of the body, and also the hair is well distributed throughout the head. The color is brown. The texture is fine. I'm going to palpate. How does it feel? Fine. No masses or tenderness or depressions noted. No infestation is noted. And now I'm going to assess the temporal arteries. I'm going to palpate. How does it feel? Fine. No tenderness or masses noted. Pre-auricular, I'm going to assess the lymph nodes. Post-auricular for masses and tenderness. The occipital. Okay. The submandibular. The submantle, the tonsillars, the anterior cervical, the posterior cervical, and the supraclavicular. Now I'm going to move on. I'm going to assess the ears. I'm going to assess, I'm going to assess cranial nerve 5. I'm going to assess cranial nerve 5, which I will be asking the patient to clench your jaws and the masseter muscles. Okay, I'm going to palpate the TMJ also at the same time, assessing for any subluxation, crepitus, or tenderness. How does that feel? How did that feel? Fine. Okay, none is noted. Now I'm going to assess the sensory mode. I'm going to ask the patient to tell me when she feels that. For what about?
Forehead. No. Cheek. Chin.
Okay. Now I'm going to ask the patient to perform cranial nerve 7, which will ask the patient to smile. Okay. I'm going to ask the patient to frown, raise your eyebrows, and pucker your lips, and puff your cheeks out. Okay. Now I'm going to ask the patient. I'm going to assess the ears. The ears are in the midline position of the body, and their size are normal. Size and shape is normal. Now I'm going to assess the auditory canal. I'm going to be making sure it is red. No redness is noted, and that the tympanic membrane is intact. I mean, it's perfect gray. Alright, no redness noted in the tympanic membrane. I'm sorry, it's pearly gray. Now I'm going to also palpate the pinna and the tragus for masses or tenderness. How do you feel? Alright, and none is noted. Alright, now I'm going to move on to the eyes. When assessing the eyes, I'm looking at the eyebrows and the eyelashes and the papillary fissulas. They are symmetrical. I'm also looking at the sclera, and I wash my hands prior to this beginning of the assessment, and conjunctiva, looking for any lesions, discharge, and redness. Now I'm going to assess cranial nerve 2. Ask the patient to cover her right eye, and we're going to assess the visual acuity and the peripheral and central vision. And let me know what's the last line you can read.
FDRO.
Okay. And the other eye.
FDRO.
And uncover both eyes.
FDRO.
Okay, and it's 20/20 vision. Then I will ask you to close your right eye, uncover your right eye, and then let me know when it's coming in. You see it, okay?
See it. I see it. See it.
Okay. Next eye.
See it. See it. See it. See it.
Okay, we're assessing peripheral vision and central vision. I will ask you to close your eye, cover your right eye for me. Okay. Let me know.
See it.
Okay.
See it.
Okay. Left eye.
See it.
Okay.
See it.
Okay.
See it.
Okay.
See it?
All right. And central vision is intact. Now we'll ask the patient to assess cranial nerve 3. And when I assess cranial nerve 3, I will be assessing the patient's pupillary response to light. Okay, and that is intact. Now also assess the patient's conjugate gaze of the extraocular motor nerve. And that's assessing cranial nerve 3, 4, 5, and 6. Look at me for me. Okay, follow me. Alright, and that is intact. Now also we'll assess the patient's pupillary response to light and accommodation and convergence of the patient's pupil to light. Okay. Okay, and that is intact. Now we'll assess the red reflex of the eyes and assessing for any internal deformities. Internal structures or deformities of the eyes. Okay, and the red reflex is intact. Now I'll move on now. Assess the nose. When assessing the nose, it is in the midline position of the body and is straight. Also assess the page to see if you will close one nostril and sniff. Okay, close the other nostril and sniff. All right, and page to see is text. You can smell out of both nostrils. Now we'll assess the olfactory nerve, cranial nerve 1. Okay, what was that?
Vinegar.
Okay, and page to see is intact. Now we will assess the lips and the mouth and the tongue. And if you would open your mouth for me and say okay. When assessing the mouth, I'm looking at the lips and the teeth. The lips, no cracks are noted. The teeth are intact, no cavities noted. Also looking at the buccal mucosa, there's no lesions noted, and then the salivary ducts are intact. And I'm also looking at the soft palate, and I'm looking at the hard palate, and I'm also gonna look at cranial nerve 9 and 10, which is the soft palate, making sure the uvula moves with symmetrical with phonation. And then I will assess the cranial nerve 12, and as the tongue is without fasciculations. Now I will actually do shrug your shoulders for me, this resistance, and that's assessing cranial nerve 11 and resistance 5 out of 5. Then we're going to assess the throat, lean back for me, and the trachea. Okay, and then I will assess thyroid glands. Say okay. All right, and also we want to note that the tonsils are size 2. Okay, and now we're going to and no issues are noted with thyroid glands. Assess the carotid arteries. Okay, palpate the carotid arteries, and then I'm going to auscultate for Bruids. Okay, no Bruids are heard. Then now we're going to go on. I'm going to assess the posterior chest. Also, I'm looking at the patient, making sure she's in no respiratory distress, and making sure that no accessory muscle use are noted, no retractions, no cyanosis, no tachypnea, and no nasal flare. I noted cyanosis is noted. Assessing for symmetry and making sure no deformities are noted in posterior chest and tactile firmitis. Say 99 for 99. Okay, now tactile firmitis. Okay, and I'm going to percuss over the long fields. I'm going to make sure no dullness or flatness is heard. Okay, now I'm going to auscultate over the long fields. Take a deep breath for me. Okay, and then I will also ask the patient to say 99, and I will assess agnophia. And then bronchophnia. whisper pectoralis. And I will ask the patient to whisper 1, 2, 3.
1, 2, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1
Alright, now I'm going to assess the anterior chest, looking for, making sure no deformities or and assessing for symmetry. Breathe in and out, say nothing for me. And now I'm going to assess for tactile phlebitis. 99. Alright, now I'm going to auscultate over the lung fields in the anterior chest. Take a deep breath. Okay, now I'm going to auscultate the arteries, and I'm starting with the aortic. It is in the second intercostal space. The pulmonic is third intercostal space on the left side. Have the Erb's point is in fourth intercostal space. You have the the Erb's point, yeah, third intercostal space. In the fourth intercostal space, you have the tricuspid, and then you have the mitral valve in the fifth intercostal space. Okay, and we're going to assess both of those using the diaphragm and the valve. And Erb's point, tricuspid, and mitral. Okay, now I'm going to ask you to lie down for me. Assess for jugular vein distension at a 30 to 45 degree angle, and look back. Okay, no jugular vein distension is noted. I'm going to palpate for thrills or heaves or lifts or the chest, and none is noted. I'm also going to palpate for thrills over the 5 heart spaces, and none is noted. Now I'm going to auscultate again over the, while lying down supine in the aortic, it's the pulmonic, the Erb's point, tricuspid, and the mitral. Now we use the bell also. Aortic, pulmonic, Erb's point, tricuspid, mitral. And we'll assess the artery PMI, and the rate and the rhythm is normal. And then we will assess for the aortic artery, the renal arteries, the iliac arteries, and the femoral arteries. Okay, and now we will make sure we will assess the abdomen for symmetry and contour, and no lacerations or scarring is noted. And also we listen to those arteries for bruise, the aorta, the renal, the iliac, and the femoral. Okay, and no bruises are heard. Now we will we will also listen to the abdomen, for all vowel sounds, 4 vowel sounds in each quad, and they are heard. Now we will percuss over the alright, listening for dullness or flatness. Okay, and you can see them. Alright, now I'm going to assess for your I'm sorry. I need you to lay back down. I'm sorry. I'm gonna assess for your spleen and liver. Okay. Alright, spleen. And we don't feel it, so it's not swollen. And the liver. And we can palpate it. It's about a size 7 or smaller centimeters. Okay, now you can sit up, and I'm going to assess for CVA tenderness. How do you feel? Okay. That is not painful. So now I'm going to move on, and I'm going to assess you're going to assess your hands, your wrists, and your elbows, and your shoulders. And when assessing it, I'm going to assess inspecting and palpating, making sure that your joints are not tender, no crepitus or nodules, noted, no redness or swelling is noted, and no deformities are noted in symmetry. Now I'm going to ask you to with your fingers, we're going to perform a few range of motions after I check your capillary refills, and it's less than 3 seconds, and your pulse, okay, is intact. Now you can feel it, okay, it's normal. Now I'm going to ask you to perform a few areas of range of motion in your fingers. I'm going to first start by extension, flexion, okay, and then abduction, and then adduction, okay, and then we're going to do no, we're still doing the fingers, okay, and then we're going to that's about thumb opposition, and that's going to be this right here, okay. Now we're going to move on to the wrist, and with the wrist we're going to ball our fingers up, okay. We're going to do flexion, extension, hyperextension, okay, and then we're going to do rotation, okay, and then we're going to do internal to the radial deviation, and then out is going to be on the deviation, okay. And we did rotation. Now we're going to assess the elbows, and get you to bring your elbows to here is flexion, okay, extension. I mean, this is hyper extension, I'm sorry, and then extension, and then flexion, okay. Then we're going to do the shoulders, and with the shoulders we're going to bring the arms out, and we're going to do flexion, okay, and then we're going to do hyper extension, and then extension, okay, I mean, we're flexion, and then extension, okay, and then we're going to do adduction, which would be away from the body, and then we'll bring them in, would be adduction, okay, and then we're going to bring internal rotation, okay, and then external rotation, and we're going to circumduction, okay. Now I'm going to stretch your strength. I want you to grip my hands for me, okay. Strength is 5 out of 5 in your hands, and then your arms, your shoulder strength, I want you to do abduction and then adduction, okay. That's 5 out of 5. We're going to do, okay, that was the shoulder. I'm doing cranial nerve labor, which is your strength in your shoulders, struggle, okay, and that's gonna be 5 out of 5, and that's gonna be 12. Okay, cranial nerve labor. I'm sorry. Now I'm going to move on, and I'm going to we did the your feet, yes, okay. And then I want to assess the capillary refills, less than 3 seconds. I'm going to assess her pulses, dorsopedius, and posterior tibials, and the pulses are intact. Now I'm going to we're going to do flexion of your toes. Bring your toes down for me, okay? And then extension will be straight out, and then adduction, spread them out, and then you bring them, adduction is in, okay, and abduction is away, okay? Now, that's the toes, and then we're going to do your ankles, okay? I'm going to ask you to, be plantar flexion, be down, plantar flexion, dorsal flexion is up, okay? Now, and then I'm going to do circumduction, okay? Rotation. All right, now I'm going to move on to your knees, and I'm going to assess the strength in your knees. Also, I would do abduction is away, adduction is in of the knees, and also let's do dorsal flexion of your strength of your ankles, okay, and plantar flexion, okay, and that's 5 out of 5. Now I'm going to move on, ask you to do your stand up for me. Okay. Also, I'm gonna assess the strength in your biceps and your triceps. Okay. This bringing your 5 out of 5. Okay, and then press. Okay, and then I'm going to assess your deep tendon reflexes. Okay, and that's your brachioradialis, your biceps. Brachioradialis, okay, your biceps, and your triceps, okay, okay, you need to sit down, and your patella, okay, and your Achilles, and then Babinski, Okay, and then I'm gonna do your hand grips. Grip my hand for me. Okay, and that's 5 out of 5. Now, if you would stand back up. Okay, and we're gonna do flexion of your hip. Okay, if you would bring your leg out, both of them. That's flexion, and then extension. Be half. Okay, and then extension on both sides. Okay, and then we're gonna do hyperextension. Okay, hyper. Okay, now and with your hip, hyperextension would be all the way back. Okay, all the way back. Okay, you're gonna bring it in, internal, and then in, abduct. Okay. And now we're gonna do circumduction. Okay, circumduction. All right. Now also, I want you to I'm gonna place the object in your hand, and I'm gonna do let me know if you can tell me what that is. Close your eyes. Okay, that's graphesthesia. Okay. Okay, and then I'm gonna do stereognosis. If you can tell me what I'm putting in, spelling in your hand. What letter I'm writing in your hand? What letter?
H.
Okay. All right. Now, also, I want to do check your cerebral function. I want to do hand flip flop for me. Okay, and then we're gonna do finger to finger. Okay, and then I want to do thumb opposition. And with thumb opposition, this also will check range of motion in her fingers. Also with thumb opposition, I forgot that. Okay, now we're gonna do okay, we did the hip. Also, I want you to do check on your gait. I want you to walk on a straight line for me. That's tandem. Okay, now turn back around and walk straight without crossing your legs. Walk straight. Okay, and that's good. Now you can come back, and I want you to stand in one place with your eyes closed and your hands out. And okay, make sure you're okay. And that's assessing Rumberg. Okay, now you are good. And also that's the Rumberg test. Make sure you're saying okay. Hop on one leg for me. Okay, and that's it. Okay, and also make sure that we did we do the flexion and extension of the knees. Okay, bring the knees back. This gonna be flexion and then extension, and then hyperextension. Just your knees. Okay, okay, flexion. Yep, flexion, and then extension, and then hyperextension. Okay, and then that was it. And then undo resistance. You can sit back down. Did we do the resistance of your strength in your knees? Okay, bring the abduct, which will be bit away, and then in will be 5 out of 5. Okay, you can stand up. Okay, undo your thighs. Okay, bring them out. Okay, and that's the strength in her hip is 5 out of 5 also. Okay, and that will conclude the assessment of our head to toe assessment. You can have a seat. Thank you.